I qualified in 1979 and started training in psychiatry in 1980. And then I did most of my training jobs in Bristol, and then came down to Devon as a consultant in 1990, firstly in North Devon. And then I came across to work in Exeter, Wanford House, 2003. There have been a number of changes, and I think some of them are structural, buildings, services. But I think the main change that I've seen through the course of my career is the way that we construct our relationships with the people that we're working with. We used to think we were doing very well if we involved people. We talked about patient involvement. But nowadays we've got a much more ambitious idea, I think, about working with them in partnership, and particularly trying to reach forward to a kind of ambition to create services together. So they're contributing their experience and their knowledge and understanding of what it's like to struggle with these sort of problems and what helps. Being a doctor and medical practice has changed quite a lot over the 30, going on 40 years that I've been around the health service. To some degree it's a question of the treatments that you've got available, particularly psychological and psychosocial treatments. But I think more so it's how you see yourself as a doctor in relationship with people that are coming for help in services. Much more as a partner in care, much more as someone who works to understand people's preferences, their choices, and works with them to discover what their experience of treatment is, and therefore what's going to be most useful to them. So I think we've changed the way that we handle our relationships with people, the way that the sort of power that might be seen as associated with the medical role is used, and often increasingly given away, given to people rather than taken from them. Before I came across what came to be known as the recovery movement, I'd already worked for a number of years with people with long-term and serious mental health challenges. And then I started hearing from people themselves about their journeys in recovery. And they were talking about how they'd overcome all kinds of obstacles, the things that mattered to them particularly, things that were personally important, and how they'd managed to customise their experience of treatment so that it worked for them. And I think fundamentally, clinical staff like myself learnt about recovery from people with personal experience, people coming into the services. The recovery movement has had a kind of expression in a whole range of activities, most clearly in things like peer support and supporting people in self-management, but particularly in establishing what elsewhere in the country are called recovery colleges, but in Devon is called a recovery learning community. I think when we set it up, we thought the idea of college was, spoke of a building and it seemed like it was in one place, whereas in fact the learning community works across a wide range of settings and across the whole of Devon. And this is a very practical setting in which people can learn from their own experience, come together with practitioners, design courses to offer that experience to other people going through similar problems. And we can use the education or the kind of learning approach as a complementary approach to treatment approaches to help people learn how to get well and stay well. And as with so many of these innovations, the learning community, again, it's 5 years old now, but it's only just starting its work. And it, I think, is a major contributor to future cultural change. It's been my livelihood. It's been my kind of place of work, a kind of occupational home. It's also an extraordinary coming together of values to do with kindness, compassion, care, and providing responses to people across the community with whatever problems they've got at the point of need, and still for free. So I think fundamentally it's a way of working with values at the heart of what we do.